Powered by
उच्च सोचको निर्माण सगरमाथा सिमेन्ट जुनी जुनीलाई।
Namaskar and स्वागत छ. Welcome to another brand new episode of Chiya Guff. With every new day calls for a new episode of Chiya Guff, and today also we are on your screen, and today is going to be equally as insightful and exciting as yesterday because we are going to have some really good conversation over tea. And today we have special guests from all the way from India, and we have not one but two guests with us. So speaking of our guests, we have Dr.Dinesh Pendharkar, Senior Cancer Specialist and Director at Sarvodaya Cnacer Institute, as well as we have Amit Agarwal, Director at Sarvodaya Hospital. We will be right back in Chiya Guff with them. Don't go anywhere. Welcome back to Chiya Guff, ladies and gentlemen. Welcome to you as well. Thank you so much for coming, and congratulations because Sarvodaya has been expanded over to Kathmandu as well, and we recently inaugurated an information center here. So we'll get into that, but before that I want to ask you, since you are a senior cancer specialist, I want to ask you about how the patterns and trend of cancer is in the world and how we can relate it to South Asia and then to Nepal.
Cancer is one of the biggest problems of the world. In fact, if we take the world statistics, cancer has become #1 killer. Earlier we all used to say heart diseases are killers, but today cancer has taken up this position world over, including Nepal. Cancer is increasing. Cancer is killing, and because it is #1 killer, we have to focus on this disease. We have to think about this disease, how we can detect early, how we can treat, and how we can save lives and we can save families. Because when a cancer patient dies, it's not death of a cancer patient, it's actually death of a family, because the whole family becomes broke with just one death. So by saving a cancer patient, we will be actually saving the family and saving the society.
So recently I have read it in the news, there has been a breakthrough in the cancer cure sector, in the healthcare sector, right? So I am not a person from the background, so I think you would be the best person to explain this to our audience.
See, we live in breakthroughs, we live through breakthroughs, and our life goes on through breakthroughs and break news and that's what our life is. Yes, there are daily advances. Recently we have been able to found a new drug which in clinical trial, please mind my word, I am talking in a clinical trial, it has proven to be very effective. But what is a clinical trial? A clinical trial means I am taking a very select class of patient, a very select group of patient where I am using this drug. This drug fortunately has been found to be effective in this very select group of very small patients. All drugs, when they come, they show such good responses, but we have to try them on a bigger population, non-selected, on all patients, then we will come to know the realities. But yes, these small breakthroughs are exciting. They help us, they keep our hopes alive, they keep our research alive. I am sure this breakthrough also will lead us to something good.
That's good to know, at least something hopeful, like you said. So when we, you just mentioned that cancer is a leading cause of death worldwide, and Nepal and South Asia is no different. But we have this narrative said that Nepali people are built different, you know, we have a better immune system, and awareness about cancer is not that effective in Nepal. So how would you compare the trend of cancer in the world to the trend of cancer in Nepal?
If you really ask me, there are about 19 million new cancer cases world over per year. In Nepal, there are about 20,000 new patients per year. These are new patients. So at any given time, I expect that there will be 60 to 70,000 people suffering from cancer in Nepal, which is not a big number, but if we take in terms of population of Nepal, it is not a small number. Yes, it is true that South Asian population, which sticks to original lifestyle, definitely has less incidence of cancer than European and American countries. So I will give you example of India, because I know that statistics paper better. So we have one state where the incidence of cancer is 250 people per 100,000 population. In America, it is something like 400 cancer cases per 100,000 population. But in same one part of India, which is a village, which probably I may compare to Nepal, the incidence of cancer is only 40. So in India alone, the difference is from 40 to 250 per 100,000 population, just because of the good lifestyle. I am sure when we evaluate Nepal, in different parts of Nepal, there will be different incidence of cancer. But at the same time, we have to remember it's a big incidence, and it is an incidence not because it is a disease, but it is a disease which goes on for a long time, involves a lot of money for treatment, it involves a lot of stress from treatment. So by saving from cancer, we will be saving the family from many more issues than disease itself.
Right. So when we talk about prevention of, we always say that prevention is better than cure, and we also need to be careful about how we can be more vulnerable to cancer causing factors in our lives, right? So in terms of being careful, there are certain lifestyle habits or many things that I'm sure you will explain better, but I want to go to you first about how Sarvodaya is equipped with the facilities as well as the manpower resources to be a part of solving this problem of rising cancer causes in worldwide or in the region.
So just to give you a brief idea about our group, it's a 30-year-old group, and the journey has been long, where we started from a 5-bedded small clinic, and today we are a group which has 3 hospitals and few outreach centers and imaging centers, a big family of around 3,000 people. And over these years, what we have learned, that accessibility to healthcare is one of the major issue that we have addressed and which we have to address further. When sir said that, or when you would say that Nepali people feel that they are not prone to getting cancer, obviously the first thought is that nobody should get cancer, but one of the reason would be that the proper diagnosis is not happening. This sir would agree. This was the case for India a few years back. It's only in the last 10-15 years when technology has taken a great stride, a lot of diagnosis and preventive screening is happening, where we are able to find out and capture cancer at a very early stage. How we as a healthcare group, as a hospital, are contributing towards it, we ensure that we continue a lot of awareness sessions. If we talk about our city, Faridabad, we have around 20 million people in Faridabad, and we've divided the city into various areas, different small pockets, and our ongoing efforts are always there in order to reach out to those particular section of the society, tell them about the screening options that are available. There are few options such as simple oral screening which can be done at their place, but then there are certain modalities like mammography, pap smear, because as per male and female there are certain cancer for which the prevalence is high. When you talk about female, it is basically breast cancer, cervix cancer. When you talk about males, it is prostate cancer. So we as a healthcare facility, as a hospital, are focusing a lot on increasing awareness, getting the key opinion leaders of the society together on a very routine basis, educate them, tell them that they need to be more aware about it, more talking about it. Initially, cancer was a taboo, proper diagnosis, a patient could not reach the right facility. Treatment is a second stage. First stage would be the person has to know what issue I have got and how and when I need to address it. Then comes the treatment and the cost part.
Right. So we will get back to the more specialist part of this question in a while. Right now it's time for a short commercial break on Chiya Guff, and we will be right back. Ladies and gentlemen, welcome back to Chiya Guff. We are in conversation with Dr. Dinesh Pendharkar, Senior Cancer Specialist and Director at Sarvodaya Cnacer Institute, as well as Amit Agarwal, Director at Sarvodaya Hospital. So, welcome back. So, we were discussing about how equipped in terms of resources and in terms of providing facilities we have to be about preventing cancer. Now I want to come to the lifestyle and the more health part of it, and I'm sure you have a very good answer for this, so let's hear it.
See, when we want to talk about treatment of cancer, we know that early detection is best. What is meant by early detection? I should try to find out the disease as early as possible. I know in Nepal many efforts are happening in this sphere. Dr. Baral, who is a senior cancer specialist, I know he has given a talk on this television. I have seen that talk on early detection of cancer. So, what are the main causes of cancer which we are aware, and I know the Nepalese population is already aware about it. So, the main three causes are tobacco, alcohol and obesity. There are many more causes, but they are beyond our control. So, tobacco is in your control, alcohol is in your control, and obesity is in your control. So, when we talk of prevention of cancer or keeping away from cancer, I would like to focus that we all should know that these are three important factors. So, if we do not want cancer, we should be away from tobacco. Tobacco means not only smoking. Tobacco means tobacco, it may be naswar, it may be gutka, it may be in some parts like bidi, any form, or maybe tobacco toothpaste, anything tobacco is tobacco, it is not different. So, in different forms tobacco acts similarly. Similar thing is alcohol. Alcohol is rated as very important cause of cancer, and use of alcohol has to be literally close to zero in life. Even a moderate use will increase the risk of cancer. And third important thing is obesity. Fortunately, in hilly areas, I know obesity is not common because people walk a lot. Walking is the best exercise, but in areas where there is no walking possible, like if you are resident in a big city and there is no movement happening, the weight increases. So, obesity is third important cause of cancer. So, I want everybody to know these three causes, and I want everybody to be away from these three causes. This is what we call primary prevention. We try to prevent cancer.
So, cancer is also caused by genetics and it's also passed down hereditary. So, how do we prevent ourselves from such conditions?
So, as I said, these three causes are preventable. They are under your control. You can stop smoking, stop taking alcohol, you can start walking extra, reduce your weight. There are two more causes which are important. One of them is infection, hepatitis infection and HPV infection. HPV infection is responsible for cervical cancer, and hepatitis B infection is responsible for liver cancer. You cannot keep away from them, but you should try to keep away from them either directly or through vaccination. And other small number of patients have a genetic cause of cancer, but that number is very small. We generally do not mention about it because it is not under your control. you are getting it through your mother and father. So you are getting it without your knowledge, without your control. So let us not talk about genetic cancer. We should only remember that if there is some family which has high incidence of cancer, so mother has a breast cancer, sister has a cervical cancer or a ovary cancer or a colon cancer, if in family there is some cancer running, then you should be cautious. You should visit your local doctor. He will advise you whether you should do screening or you should not do screening. The cancer specialists are already aware of these factors and they will tell you whether you should consider this factor seriously or not when you tell them the family history. Scientifically, many things are possible. We can do genetic testing of literally every individual and we can predict the risk. But remember one thing, whenever anybody talks to you about the risk, it is a percentile risk. So I will tell you that you got 5% chance of getting cancer. But what does this mean? This means you have 95% chance that you will not get cancer. So try to read the message correctly and you have to decide whether you want to give weightage to this 5% or 95%. So please, all medical information, relate it, read yourself, go to your local doctor, don't go to a specialist first, go to local doctor to whom you show daily, he will be your big help.
Thank you so much for the clarification. Now, so what should we do to, in order, like we know that we can quit tobacco, we can quit drinking and we can focus on fitness, but what should we, take the steps that we as collectively should do in order to like fight this huge cause of death?
So first thing I would say, prevention. So avoid these three causes which you can avoid. Second is early detection. So early detection, remember one thing, cancer generally, not always, is the age of the disease. It happens beyond 40 years of age. So if after 40 years of age, if you have caused 40 years of age and you have some symptoms which you find are not usual, if you are 40-year-old, you already know how your body looks like, what problems you have, what problems you don't have. By 40 years, every person is intelligent. So if there is some new sign after 40 years, for example, your age is 40 years and now you start getting cough and the cough is not going for 7 days. Any symptom which is remaining for 7-10 days is not going and you are already old, more than 40 years, you should start thinking that this could be cancer. I am not frightening you, but don't take decision immediately, wait for time. And if we start thinking, we'll start detecting early. So this is how we can early detect cancer. So the first treatment of cancer is early detection.
Right. So now coming back to the inauguration of the information center here in Kathmandu. We recently did it a few days ago. Congratulations on that. So I would like to ask you, what are the services or facilities that we can access from the information center in Kathmandu?
Yeah, so as I mentioned, that accessibility to healthcare is one of the major challenge, be it Nepal or be it India. The purpose of opening the center over here is that we have a lot of people coming to our hospital from this particular part of the world. They would have a local facility which is close to their home, which would ensure that once the person has visited our hospital and has come back, there are a lot of things that are required as a part of follow-up, getting in touch with the doctor again, getting your medical condition reviewed on a regular basis. So this center would be their local center for all those things, because the intervention that was required for the patient, that has been done. A lot of work is required before the intervention is required and after the intervention is required. Be it getting in touch with the doctors through teleconsultation, be it getting your medicines reviewed, getting your medical symptoms reviewed. So for all those things, this center would be the point of contact for these patients in their own geography. They don't have to travel post intervention unnecessarily to India or be it any hospital for just regular follow-ups.
So can we also do pre-intervention arrangements, like also before going to the hospital?
See, whenever a patient has to go to as sir suggested, the person should first go to his or her family doctor, because initially, and nowadays this concept is dying a bit, but the family doctor always knew your parents, your grandparents. So apart from your medical condition, he would know what has been the problem in the family. If the grandfather, the father was having diabetes, there are chances that the further generation would will get this disease. So before coming to the hospital, the person over here should go to a local doctor and share his symptoms and medical condition. And there are obviously few tests which a person would have to go through. We have all those reports, be it radiology, be it imaging, or be it lab test. Once all those tests are in place, even our doctors are better placed to comment whether you actually need to travel to India or any other country for your treatment, or it can be addressed locally. Since we have very good relationships with the local doctors, they themselves can take care of the patient end to end, and our team over there can be in touch with the local doctors here, and this eventually saves a lot for the patient. Many a times it is not the treatment cost that is a burden. Many a times the cost involved in traveling, because the patient alone does not travel. His family needs to go with him. His entire cycle over here gets hampered. So all that expense is much larger than your treatment cost. So all of those benefits would be available for the people over here.
Right. So there is also a problem of middlemen who, you know, like agents and middlemen who connect patients from Nepal to India, and they take a lot of money in between. So I suppose this information system also.
So the center would address that issue to a larger extent, because they are directly connected to the hospital person.
Right.
Yes.
So when we speak of Sarvodaya Hospital, it's not just about cancer, right? It's about a larger, everything under the same roof.
Sarvodaya Group, as I said, it's a 30-year-old group. Today we have 800 beds distributed in our 3 facilities. The flagship hospital, which is a 500-bedded super speciality Sarvodaya Hospital in Faridabad. It is a super speciality hospital, and it has everything inside under one roof. When we talk about cancer, all the modalities, be it medical oncology, bone marrow transplant, surgical oncology, radiation therapy, be it nuclear medicine, there are such advanced therapies in nuclear medicine that we as a center can do, and our center is also capable of handling the adult as well as pediatric patient when we talk about cancer. Apart from cancer, the cardiology is there, adult cardiology, pediatric cardiology. Joint replacement program is one of the most developed program in our facility. We are also having the fully active robot, which is not there in any other facility in North India. Kidney transplant, and so whatever you think, obviously our first suggestion would be that people should go for primary screening and preventive lifestyle. However, if there is somebody who needs healthcare, then definitely we are capable enough to provide all the services under one roof.
Right. So at the moment we're going to watch a short footage from the inauguration day about the Sarvodaya Information Center here in Kathmandu, and we will be right back. Alright, welcome back. It was quite a good scene to see that, to see the opening of the Sarvodaya Information Center here. So, so what are the further plans or further visions of extension in Kathmandu or inside Nepal from Sarvodaya Group?
See, the starting is obviously very humble. It is something like how we started in India. It was a very small clinic, and the chairman of our hospital, Dr. Rakesh Gupta, he himself is a physician. So we understand how the patient goes through whenever there is a medical condition. So the starting is humble. We are starting as an information center, but we would definitely want to get into the radiology, imaging and advanced diagnostic tie-ups first, because we as a group believe in going slow but steady. So establishing advanced diagnostic would be the first step, and then maybe if things work, having a very good daycare center, radiation therapy center, all those will follow with times to come.
All right. I hope we get to see that happening very, very soon. So for now, it's time that we head towards a short commercial break on Chiya Guff. We will be right back. Don't go anywhere. Welcome back, ladies and gentlemen. We are in conversation with Dr. Dinesh Pendharkar, Senior Cancer Specialist and Director at Sarvodaya Cnacer Institute, as well as Amit Agarwal, Director at Sarvodaya Hospital, Faridabad today. Welcome back one more time. So we don't have a lot of time left on the show at the moment. So quickly before we wrap up, I would like you to share some message as on, you know, because you've had a long experience in this sector. So is there anything that you think that everybody should know about cancer and would be a good message for everybody to learn?
So I just would like to tell everybody that cancer is preventable, curable if detected early. Controlling cancer is in everybody's hands. It is not the responsibility of somebody to control cancer. It's all of us together responsibility. So I expect that all of us take part in it. Second thing what I would like to say and what I believe in it is empowerment. So we as a group, I as an oncologist believe in empowerment of the doctors and physicians, and I want my colleagues from Nepal who are working in social sector, they should come forward and do empowerment of the society in awareness. So we both together, society and we group of doctors, we both are responsible for making our society aware, and awareness is the key to all the solutions.
So before we go, I want to ask a question to you, because you mentioned that a lot of Nepali patients are going to Sarvodaya for, you know, healthcare. So do we have a number or stats that can be shared, you know, certain number of people in this amount of time?
There is no, I mean, again, like you talked about the recent study about the colorectal cancer. The sample size is not that big, basis which you can comment on something. We have people traveling for cardiac issues, oncology issues, orthopedic issues. But with the establishment of the information center, this number would definitely pick up. Maybe then we would be better placed to comment on a general trend.
Right.
Yes.
So for now, we will take a look at another footage and then we will be right back. Don't go anywhere. Welcome back, ladies and gentlemen. So before we go, I have one last question for both of you. As we spoke about empowerment of communities as well as physicians and medical professionals, what have you done from your own individual level or organizational level for the message that you just sent a while ago?
So I believe in empowerment of the physicians. I believe in empowerment of the local skills. That has been my power for last more than 40 years. I'd been to Nepal in multiple medical educational sessions. A lot of my colleagues, friends, brothers from Nepal have been to me in India. I come here, they come there, and we constantly exchange the new information on cancer. We had a very great discussion yesterday also, and we discussed with the local physicians how we can use this empowerment philosophy to further bring cancer care to a peripheral level, to a lower level, so that patient does not have to travel. Even in Nepal, he should not travel to Kathmandu. If we can do something that before coming to Kathmandu, he gets some support in the periphery, and this we can do through empowerment. So the philosophy of empowerment is with us. We will be really working very hard to empower all my local friends so that they can empower further a physician below down. Thank you.
Right. Thank you so much. So for you, it's quite interesting to know that a company with 30 years of legacy, and now you're expanding internationally to Nepal, and this will also grow in the future, right? So what is the core principle or philosophy that Sarvodaya Group follows?
See, like any car would need all the four tires to function properly, and when all the four are working in sync with each other, then only the car can run properly. Similarly, we focus on basically four parameters, and we've tried focusing on this for the last 30 years. First is our 3,000 strong people who are there as a part of the Sarvodaya family, because it is those 3,000 people, be it doctors, nurses, paramedical staff, technicians, housekeeping staff, who are in touch with all our patients on a daily basis. They need to imbibe the philosophy of our group, because they are touching the patient. It is not possible for us to touch every patient. So our first pillar is our 3,000 strong people. Our second pillar has been transparency. We focus a lot on transparency and clear communication with our patients. They need to be told again and again about their condition and how the treatment is progressing. Our third philosophy is cost-effective treatment. We as a group understand that for any family to face any medical condition, be it cancer or cardiology or anything else, it is a financial burden. So we as a group try to optimize and rationalize the cost as much as possible. And our last pillar would be personalized care. Although we are a 800 bedded group, but somehow we have managed to establish the ecosystem so that because every patient is unique, even two cancer patients are not behaving in a similar fashion. So personalized care for the patients, that is our fourth pillar. So basis these fourth pillar, we've existed so much and we aim to exist for a long period of time.
Great. All the best for the future, and congratulations once again for expanding to Nepal.
Thank you.
And thank you so much. I'm sure we will reap a lot of benefits from the information center here. And thank you so much for being here
Thank you.
today. Thank you so much for watching. We will be back tomorrow again with another episode of Chiya Guff. Until then, keep on watching Prime Television. Bye-bye.
पावर्ड बाय उच्च सोचको निर्माण सगरमाथा सिमेन्ट जुनी जुनीलाई।